In this video, we are discussing lung as an organ. Why lung design matters. At the end of a deep inspiration, the lung volume is composed predominantly of air, which accounts for 80%, blood about 10% of lung volume, and the remaining 10% consists of tissue. This relatively small amount of tissue is distributed over an enormous surface area. As a result, lung appears structurally fragile, yet it is required to meet a very high functional demand. The core function of this design is to achieve efficient gas exchange. Mechanical design supporting gas exchange. In the lung, air and blood are brought to extremely intimate contact, but they remain strictly separated. The structural design of lung ensures mechanical stability while simultaneously providing optimal conditions for diffusion. Because of this design, effective gas exchange can be maintained even during periods of heavy physical work. Lung volume and position in thorax. In adults, total lung capacity is approximately 5 to 6 liters. At total lung capacity, lung fills almost entire thoracic cavity. During expiration, the lung retracts from the pleural cavity and the posterior basal edge of lung move upwards by about 4 to 6 centimeters. This retraction is not localized but occurs throughout the lung tissue. Pleura, the structural basis of lung mobility. Mobility of lung depends on a serosal surface that is formed during morphogenesis. This space is lined by two layers, the parietal pleura and visceral pleura. Pleural space itself is minimal because the two pleural layers lies close to each other. A thin layer of serous fluid between them acts as a lubricant and allows smooth movement during respiration. Pleural mesothelium and fluid dynamics. Both pleural surfaces are lined by a squamous epithelium known as mesothelium. These mesothelial cells are rich in apical microvilli. The total volume of pleural fluid is approximately 15 to 20 milliliter. The fluid contains mainly macrophages, followed by lymphocytes with a small proportion of mesothelial cells. Pleural fluid is formed from pleural capillaries and it is drained primarily through lymphatic stroma in parietal pleura. Visceral pleura connective tissue architecture. The connective tissue of visceral pleura is organized into three layers. The superficial layer is rich in elastic fibers. Beneath this, there is a deep fiber sheet that extends into alveoli. Between these layers lies loose connective tissue. This connective tissue contains free cell, lymphatics, and branches of systemic arterial circulation. Hilum and pulmonary ligament. Lung is attached to mediastinum at hilum, which serve as an entry point for bronchi and blood vessels. Additional support is provided by pulmonary ligament, which is a narrow pleural fold that extends downward from hilum, and these structures anchor the lung while allowing vertical movement. When a pneumothorax occurs, the lung retracts towards the mediastinum. Lung shape and surfaces. The shape of lung corresponds to that of fully expanded pleural cavity. Three surfaces can be identified: the convex costal surface, the concave diaphragmatic surface, and the mediastinal surface, which allows impression of heart. This overall shape is maintained by pleural coupling. Bronchopulmonary segments. The lung is divided into anatomical subdivisions known as bronchopulmonary segments. The right lung is composed of upper, middle, and lower lobe. The left lung has only upper and lower lobe, with lingula serving as equivalent of right middle lobe. The medial basal segment is typically absent on the left side. Airway branching pattern. The airway branch in a dichotomous pattern with approximately 23 generations extending from trachea. With each generation, there is a progressive reduction in airway diameter. The final 9 generations are closely associated with alveoli and represents the primary site of gas exchange. Relationship of airways and pulmonary vessels. Pulmonary arteries follow bronchi and remains centrally located within lung units. In contrast, pulmonary veins follow an independent course and are located between bronchopulmonary units. These veins drain blood from multiple adjacent units. Acinus and secondary lobule. Acinus begins at level of transitional bronchiole where all airways have alveoli and participate in gas exchange. The secondary lobule is approximately 1 cubic centimeter in size and is supplied by an airway about 1 millimeter in diameter and is bounded by connective tissue septa. Functional consequences of parenchymal organization. Lung units share venous drainage and are not separated by complete connective tissue septa. As a result, the disease process tend to spread across adjacent units. The lobes are only lung units that are truly separated from each other. In summary, the design of lung prioritizes minimal tissue and maximal surface area. The pleura plays an essential role in lung mechanics. Airways and blood vessels follow distinct spatial arrangements, and this structural organization explains many patterns of lung diseases.